Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who's on our panel today, and then we will open it up for opening statements from our health officials who are in attendance. We're joined by Mayor Pro Tem Frida Powell, Casey Stoughton, City of Amarillo Public Health Director, Dr. Todd Bell, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmetier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and start today with Casey Stoughton, City of Amarillo Public Health Director. Casey, how are you?
I'm well, Dave. Thanks. It's good to be here this morning. It's an exciting day today as vaccines are now available for children 5 to 11. As a mom, I am super excited about this. My youngest isn't quite 5 yet, so we're going to wait till the next round to be fully vaccinated as a family. But man, I am excited because we're moving towards having a population that's able to be vaccinated kind of in total. So it's a really good day. All of the approvals for the Pfizer vaccine down to the age 5 that have for that pediatric indication are in. And so we do have that pediatric Pfizer product available at the public health department, along with Pfizer for adolescents and adults and Moderna. So lots of vaccines going on at public health right now. We're giving those vaccines at 850 Martin Road. So that's the building just next door to public health. So good day for vaccinations in public health. And a good day for moving toward a more protected community. We'll talk a little bit about the numbers and then hear from our medical professionals as well. So as of today, there are a total of 47,369 cases of COVID here in our community. We're down to a total of 1,935 active cases, and we have 913 deaths here in our community. And that's since March of 2020. The 5-day new case average is at 96 new cases per day. So thankfully that number is definitely going down, but still seeing lots of new cases each day. Yesterday, our GA34's hospitalization percentage was at 10.66%. While we're no longer an area of high hospitalization, we're still in level red. So currently 3 of the 4 metrics are in level red, though the numbers are looking better each week. The rolling 7-day positivity rate is currently at 7%, and the positivity rate at the drive-through testing site is at 35%. We do have COVID testing available at 378-6300. COVID vaccines that we've talked about, again, are located at 850 Martin Road, and that's a walk-in clinic. You don't need an appointment, just come see us. Again, at the 378-6300 number, you can also schedule an appointment for STD testing, TB testing, our regular immunization services. And then we also still have our monoclonal antibody clinic that is available by appointment. You can call 378-6300 if you are positive for COVID and fit in one of those high-risk categories. And those categories are pretty generous. So a BMI over 25, a chronic health condition, anything, we sure want to make sure to treat with Regeneron so that you don't progress to severe disease. And we're also able to treat with Regeneron for contact, so people who've been in contact with a positive COVID case. So talk to your doctor about that. We're happy to take referrals. If you don't have a doctor or need a referral, then call us and we'll help you move through that process. That's all I have today, Dave. Thank you so much.
Thank you, Casey. Let's now go to Dr. Todd Bell, Public Health Authority, Texas State University Health Sciences Center. Dr. Bell, how are you?
I'm doing well, David. Thank you for the opportunity to be here. I'd highlight, I guess, a couple of things. So first of all, again, big news from a vaccination standpoint, the availability of vaccines for kids ages 5 through 11. Those who wonder or are interested, we do have actually pretty good data. So there's about 3,000 kids that were enrolled in that study, 90% efficacy in decreasing the risk of getting infection from COVID in those children that were vaccinated. The kids that got the vaccine had the same kind of side effects that we would anticipate. The same thing we've seen in adults, which is that you get most kids, if they're going to have any issues with it, they're going to have a sore arm, low-grade fever, maybe some muscle aches. That's going to happen within 2 days of the vaccination. That's the immune system at work. Then those symptoms are going to go away within 2 days. Again, that's the immune system at work. So what I want to do is to be sure and encourage folks that this is a type of vaccine. It is a vaccine that has been studied. It actually is a really well done study. And we feel safe and encourage people to get those vaccines for the children age 5 to 11. I've had multiple pediatricians call me this morning and ask me, can they have their own kids get the vaccine yet? Is it available and where is it at? And so for all the pediatricians out there who are wanting to vaccinate their own children, I'll let you know that, hey, go ahead and just head on over to the health department, 850 Martin Road. They're going to be able to get those vaccines set up. Obviously, other people can also take their kids. You don't have to be a pediatrician to get your kids vaccinated. It just happens the pediatricians have my cell phone number. The second thing that I would point out is that we are getting into the holiday seasons, and I'm still feeling very confident about what our transmission rate is going to be when it gets to the holiday seasons. We are seeing kind of a slow, steady decline in cases and hospital pressure as this surge continues to wane away, but it's taking some time. As we get into the holiday seasons, we still want to encourage people that if you're in a crowded indoor place, we encourage you to wear a mask. People can get COVID a second time. Even if you've had COVID in the past, you can still get COVID and potentially transmit it later on. We do see breakthrough cases or breakthrough infections in folks who have been vaccinated. So there's still a role for masks when people are in those crowded indoor places, high risk activities, and things like that. So I would encourage people to continue to do the good job of being able to help protect yourself and your family and your community. And then again, I would just highlight again the importance of vaccination and being able to bring this pandemic to a close. Obviously, it's never going to go away completely, but as we make this shift from a pandemic to an endemic disease, then that's going to be something that we're just going to all have to learn to live with and be able to mitigate and minimize the risk from the virus.
Thank you, Dr. Bell. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hi, good morning, David. Well, I am feeling a bit impatient. There's no doubt, as we've all said, that we're seeing some really promising trends over the last couple of weeks. It's just not happening fast enough for me. So one thing, if you look at the report card, you'll see that we had a kind of a steep curve down, and now we're in this tail. And I've heard Dr. Bell give some elegant explanations as to why we have this tail, and we're expecting this kind of smoldering process from here. But it's very much mirroring what we're seeing at Northwest. So essentially back in September, we were up into the 50s and 60s in terms of the number of COVID patients. From October 1st to about the 25th, we were stuck in the low 40s, 42, 43, 42. And then we had a sharp decline at the end of October. And from October 27th to now, we're stuck in the low 30s. So again, we're just smoldering at this low 30s in terms of our numbers. So I agree with Dr. Bell. I really hope that by the time we hit the holidays, we'll have had a couple more of these drops and plateaus, and we'll be down at a very safe level. Right now, today, we have 31 COVID positive patients at Northwest. Out of those, only 5 have been vaccinated, and that includes 1 in the critical care unit and 4 adults on the normal regular floors. Those 31 represent 6.3% of our total licensed beds, but about 13% of the inpatients we have right now. We have 8 of those patients in the ICU and 5 are on ventilators. So overall, we've been able to consolidate our ICU and one of our med-surg floors to really accommodate the patients with COVID-19. Now, here's the thing, you've heard us talk about that first wild type surge, the virus, was mostly affecting elderly people. We are seeing such a distribution now. So today we have patients in the adult ICU, on the adult med-surg floor. We have a couple patients in the pediatric ICU, a couple patients on the PD floor. We have a couple patients on labor and delivery, and a couple in our acute rehab unit. So what we're seeing is this distribution of COVID across all age groups in the hospital here. So no one's really safe in that sense. And again, I would encourage everyone to consider vaccines for everyone that's eligible to receive a vaccine at this point. Now, in terms of our testing, we're matching very what much Casey said. We've got about a 7 to 8% daily positive rate in terms of our outpatient testing. So that's down from about 20% about a month and a half ago to 2 months ago. Now, in October, we had 20 individuals who lost their lives to COVID-19. That's 20 tragedies. And that included a couple people in their 20s who died from the virus. Right now, we're at 1 death for November, but hopefully we'll continue to see that drop sharply off. In terms of our staff, we have 15 staff members who are quarantined right now. We are starting to demobilize the visiting nurses, and we expect to be completely free of all the visiting nurses that's come through the RAC and through the government by the first week of December. So that's going to be a challenge because they've done a great job for us, and we got to make up that difference. So we've talked about how we've been trying to bring in some of these patients from the regional facilities who need a higher level of care. And I think we got down to where there's only 3 to 5 patients waiting in the region, waiting for beds at either BSA or Northwest or the VA. Today, we're back up to about 13 patients out in the region. So again, as we lose some of these traveling nurses, that will become more of a challenge for us to bring some of these patients in, but we will continue to work with our regional partners. Finally, I just want to say, this week is the Medical and Surgical Nurses Week. And we've talked about those nurses as well as our critical care nurses have really been the ones that bore the brunt of this pandemic for the last year and a half. So please, if you have a family member or you know someone who is a medical surgical nurse, please tell them how much you appreciate all they've done during this time. That's all I have today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lementier, Chief Medical Officer for BSA. Dr. Lementier, how are you?
Good morning, David. I'm doing well. Good morning, Amarillo. I think this is a positive day today. I agree with our fellow panel. Multiple things to be happy about in terms of where we are right now. Our numbers are declining at BSA in terms of our hospitalized COVID patients. Very similar to what Dr. Weiss mentioned, we were in this really kind of smoldering pattern where we couldn't get less than about the mid-50s in terms of total COVID hospitalized patients at BSA, going on for weeks now. But since the last week of October, where we were as high as 55 hospitalized patients around the 28th of October, we're now down to 35 total hospitalized patients. So it's a drop of 20 in our census, which we haven't been this low for quite some time. Of those 35 patients, 21 of those are in our intensive care unit, and 13 of those 21 are on the ventilator. We have 14 patients on our general med surg unit. In addition to that, this statistic has been holding consistent throughout the pandemic for us, and that is that 83% of the total patients we have hospitalized now are not vaccinated. And that trend holds through in terms of the majority of the patients that go on to the intensive care unit are not vaccinated. The majority that go on to the ventilator are not vaccinated. And the majority that end up, unfortunately, succumbing to COVID-19 are not vaccinated. That has held true consistently, not only at BSA, but also at Northwest per our discussions with Dr. Weiss and Dr. Gonzalez for his population. With that being said, we also are still dealing with some of the issues that we have with staffing concerns. Yes, we're going through the same demobilization process this month with our RAC support nurses who have been a big help to us. We also have hired ourselves travel nurses in a larger contingent to help support our core nursing staff. And again, that's going to be an ongoing challenge as we continue to try to manage a high inpatient census overall, while we have some of the support staff that is being pulled away, which we understand has to happen. 18 of our staff members now are quarantined, and the majority of those are quarantined because they are infected. And we're seeing about 50% of those that are infected having been previously vaccinated. But I'm going to talk about that a little bit as well here with some additional data in a minute. We continue to have very high ICU volumes overall, and I'm talking about both COVID and non-COVID population filling up our ICU. This is the time of year when we tend to see a lot of respiratory illness outside of COVID-19, as you know, in historical years, influenza, RSV, multiple other respiratory pathogens, bacterial pneumonia, especially in those patients that have chronic lung disease and are predisposed to those types of infections. So we can't emphasize enough that it's critical for everyone to get their flu shot again this year and make sure that you are protecting yourself from that standpoint. There is very good data that shows that when you get the flu shot annually, the serial flu vaccinations year after year put you in a much better state as far as protective immunity than, number one, never having had the flu shot, and number two, even compared to those individuals who've got the flu shot just one time or just for a shorter period of time over the past 1 or 2 years. So it's critical to get yourself into that category where you're one of the annual flu vaccine receivers, if you will. The hospitalization rate, as you know, as Casey mentioned, is down. We're down to 10.6% of our trauma service area as far as COVID hospitalizations, which is fantastic. We hope it continues to drop. Our testing numbers are showing that month to date, we're down to 8% of all of our tests are showing positive, which is much lower than we were. We finished October at 11.9%. And I'm hoping, and we are, really with the winter coming up, that this continues to decline in terms of the COVID positivity. But I think there's a couple of key things we need to mention, and then I want to pass the baton over to Dr. Gonzalez after this. And the first thing is, one, there was a study that was put out by the CDC, published by the CDC, not performed by the CDC, that looked at what the likelihood is for someone to be reinfected with COVID-19, or infected with COVID-19, I should say, if you were previously infected natively versus if you were vaccinated. And what they found is that you're 5 times greater to be reinfected with COVID if you're relying on a history of natural infection versus vaccination. So people say, well, I've been infected, I'm good to go. No, you're not good to go. A history of natural immunity based on a previous infection does not give you as good a protection as the vaccine, number one. And what we're seeing with natural immunity and even with the vaccine is that there's a period of time beyond which you're more vulnerable again to get reinfected. What it's also showing is that it looks like folks that are vaccinated clear the infection faster when they do get reinfected or infected primarily because they weren't before, for instance. And again, that's important because if you're vaccinated and you clear the infection more quickly, the likelihood of you having severe disease as a result of COVID-19 is going to be very low, which is another reason why we've all been touting vaccination. The data continues to show favorable benefits to vaccination. And then there was a UK study that came out also this week that talked about what's the likelihood of a household contact to get COVID-19 if you're vaccinated, meaning, is it likely that you're going to transmit the virus even when you're vaccinated in the household? And they were specifically looking at a time frame when the Delta variant has been prominent. And what it's been shown based on this study is that if you have individuals in the household who are vaccinated, you're much less likely to transmit Delta among one another, but you can still transmit Delta, which is part of the reason why it's felt that we're still seeing reinfection rates and rates across the world, even in countries that have high vaccination rates. The vaccine's not 100% protective, but again, it protects against severe disease, and you're far less likely to infect a household member if the household is vaccinated. This is great news in terms of the timing with the pediatric vaccination approval now with Pfizer, so that we can get more of those household primary members vaccinated in the appropriate age ranges, and thereby decrease risk for the entire family, decrease risk for those individuals who are elderly, immunocompromised, all of us who have friends and relatives and others that come into our houses that are going to be a greater risk for a reinfection. And then the potential for that being a severe infection. Remember, we still have individuals that are coming into the hospital that are succumbing to COVID-19 and have been vaccinated. And again, those individuals are typically those that have significant chronic illness, weakened immune systems, and again, are not totally out of the woods in terms of that risk. So we need to ask those of us that are able to help decrease the risk for those, many of whom are our loved ones, by doing the right thing and getting the vaccine. And then the last thing I'll say is, again, we need to put our faith and our beliefs in good science. And there was additional data that came out this week that showed that the initial large meta-analysis that was touting the use of ivermectin for COVID-19 had serious flaws, which we've all been commenting on here previously. And those serious flaws have brought into question the validity of that data to an extent where there is a significant compromise of individuals' ethics that were publishing that data. And the reason I say this is not to pick on that group of individuals, but it's to basically bring up the point again that we have to be scrutinous of the data that we're looking at when we're looking for an effective therapy against any disease process. And to date, there is not good evidence outside of the therapies that have been mentioned multiple times on these calls, vaccinations, monoclonal antibodies, some other drugs that we use in the hospital setting, steroids at the right interval and timing. Outside of those drugs, the care for COVID-19 is largely supportive. There are going to be new drugs coming down the road, we hope, and there's going to be additional data that we are not aware of today that's going to show different medications that some may be things we've used for other things and other disease processes are going to show to be beneficial. There's an antidepressant now that Dr. Bell has mentioned that we're aware of called fluvoxamine that may have some efficacy against COVID-19. My point is we have to wait till the data comes out, scrutinize the data, make sure it's peer reviewed before we tout it as an effective therapy. But this is a positive day, folks. We are moving in the right direction. I think we're going to continue to do so. Getting our pediatric approval for vaccines now is a great addition to our armamentarium. And I think we have a lot to look forward to going into the winter months where we're going to be more well protected if we do the right things. Thank you.
Thank you, Dr. I'm now going to go with Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, Dave. Thank you. So I'll go right into our numbers, and it's really easy to report today. We have one COVID patient in our hospital, in our ICU. As all the panelists have said, I encourage all members of our community, if you are eligible to receive the vaccine, please go somewhere that's offering it for you to get the vaccine. Here at the VA, for our veterans, spouses, caregivers of veterans, we have the Moderna and the Johnson & Johnson vaccine. We are doing boosters for both vaccines. So for those that are eligible and interested in the booster, just as a reminder, to get the booster for Moderna, it has to be 6 months after your second dose of the Moderna series. And for the Johnson & Johnson, it's 2 months after the single dose of the series. So we want to make sure that our veterans and spouses, caregivers understand that we are offering that and you can come to the VA to get that. We are offering it both here and at our Lubbock campus. Now, also, I want to talk, as you know, next week is Veterans Day. And so we will be doing things to recognize our veterans throughout the week. But this Saturday, we have our Welcome Home event. And I know, unfortunately, I still haven't seen how the Welcome Home works in the pre-COVID era. And I'm really looking forward to that. We're going to do this similar to last year, where we are doing a drive-through. We'd like to thank many of the organizations throughout the community that have sponsored things. We have several prizes that will allow veterans to enter a drawing for, but we also, United Supermarkets is providing a lunch for the veterans as they come through this drive-through Welcome Home. And lastly, I want to thank all of our veterans throughout our community for your service to our nation. Appreciate all you have done, and we are honored to be able to serve you through our VA here. And lastly, I'm going to thank Jared for his service in the United States Navy, because I know he follows me. And so thank you, Jared, for your service to our country.
Thank you, Dr. Gonzalez. Let's now go to members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's start with Kevin Welch of KFDA News Channel 10. Kevin, how are you?
I'm good. Thank you, Dave. This is for the two public hospitals. Have you all heard anything back from your corporate leadership about vaccine mandates for staff?
At BSA, we're continuing to monitor the federal potential mandate that's coming forward. We have made no determinations at this time about how we're going to move forward. Obviously, if there's a federal mandate, We're going to need to evaluate how that needs to coincide with the governor's executive order, and then make a determination from that point forward.
Yeah, Kevin, I say we're in the same boat. I think it's going to be kind of interesting to see, as Dr. Lemon, saying, the federal versus the state directives on this. So I'm sure there'll be a lawyer or two involved in this, and we'll just wait to find out the outcomes.
Okay. Dr. Bill, do you have any feel for when we might be coming off of level red?
Yeah, so Kevin, that's a great question. You know, if the downslope of our surge was the same as what it had been with our other surges, we would have been coming off of level red probably this week. As it is, we've got this longer tail. Again, there's a lot of things that potentially go into that longer tail. And by tail, I just mean that if you look on the curves, you see that we still are like probably threefold higher than what we were as far as the daily case rate than what we were prior to the Delta and the September surge. We are seeing those numbers come down. My guess, and this would purely be a guess, would be that we'll probably be able to get off of level red within the next 2 weeks. But again, we're really are trying to just follow the numbers and be able to make our decisions based on those numbers. And right now, we still have 3 out of 4 of those metrics are in the red. I will also say that as this becomes more of a chronic issue that we see every year, because again, COVID's not going away. As it becomes more of a chronic issue that we see every year, at some point we do also need to readdress, do the metrics still mean the same? If someone has had a prior vaccination and they have a breakthrough infection, that's going to be a milder case. If someone has had a prior infection and they get reinfected, that's probably going to be a milder case, although it's not as predictably so. And so if those things happen, then at some point that the effect on the hospital of the transmission rate starts to change. Because if the more of the cases are milder, then we don't see as much of a pressure on the hospital system. So again, we'll keep watching. Again, we've got our metrics that we're following, and then we continually reevaluate what the meaning of those metrics are. And the dusty, mud-encrusted crystal ball would say that maybe 2 weeks from now, we'll be in a position to come off of level red.
Okay. Can you tell us what the 3 metrics are that are holding us back?
Sure. Actually, Casey's got the actual numbers there probably.
Okay.
You mind picking that up?
Casey?
No, not at all, sir. So it is the 5-day new case average is still over 80, as is the adult bed utilization and the ICU utilization. And those are found on the dashboard.
Okay, thanks. And Casey, do you have any kind of anticipation about demand for kids getting shots?
You know, kind of like Dr. Bell said, we've had lots of phone calls today and have had so in the last several days of parents, you know, wanting to know when we'll be open and when we'll have vaccine available. So I know that there is some demand. And so that's, you know, we're really hopeful for that and thankful for that. So, you know, want families to know that the vaccine is available. And then if there's others that have questions, and, you know, their pediatrician is a great resource to ask questions of. We're happy to answer any questions that families have. But yeah, so we've had lots of interest.
Okay. Have you had any discussions with the school districts about cooperation?
Yeah, you know, we have, and you know, our team is amazing. And so sometimes I don't always know what everybody's doing because they do so well at their job. And so I know that we do work with the school districts, and we've had lots of clinics and done different things. So I would imagine that the team is continuing to work together on those things. But so yes, absolutely.
Okay. And Dr. Weiss, Dr. Lemon-Tier said that Northwest hired travel nurses beyond the RAC nurses. Did Northwest?
We have not, no. So we are totally dependent on the RAC nurses and then our employed staff.
Okay, that's everything. Thank y'all.
Thank you, Kevin. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are you?
Good, thanks.
First question is, are adults able to get the Pfizer vaccine also at Amarillo Public Health?
Yes, so the booster is available. I mean, or the first and second dose. Yes, Pfizer is available.
Okay, and you've already started giving vaccines to the 5 to 11s this morning, correct?
Yes, we started that this morning.
All righty. Any supply issues that could come up, or were you all anticipating this and kind of got a supply built up?
Well, the vaccine is ordered through the state and then through the CDC. So there is, we're always working together with them to make sure that, to order vaccine and whatnot. So there's always the potential, so we'll continue to monitor our supply and order as needed. But the way that the vaccine is allocated is certainly complicated.
All righty. And now that the younger kids can get it, are y'all planning any, kid-focused vaccine clinics with the mobile unit, or someplace else, or just the normal walk-in at the health department?
So we have, it's a great question. We have mobile outreach clinics available fairly regularly. It's their parents have to be involved. We certainly have to have consent, and their parents have to be there. So we can't. So it's we have to be available when parents can be available and kids can be available. So it's we'll certainly make sure that we can do that. We're looking at different hours and how we can be available, but it's a little bit different than just kind of pulling up to someone's workplace and moms and dads can just kind of come out at lunch. Like it's a little more complicated than that, but we certainly want to make sure that we can be available to kids and to parents at the most convenient times. And so all of that to say, yes, the planning is certainly there, and we will take vaccine for kids available anytime that we're out on the road.
All righty. And one last question. With the vaccine being open up to younger kids, are we hoping this could possibly help us reach true herd immunity quicker, getting more of the population vaccinated?
So herd immunity, again, somewhat of a moving target. Because what we've seen is that with both native infection as well as with vaccines over time, we do get some waning of the immunity. So if we were going to somehow get everybody in the world immune at the same time for 6 months, that would actually get rid of the virus entirely, theoretically, except for, again, potentially other species. But but when we're looking at herd immunity, I think that it gets us to a point by being able to get kiddos vaccinated as well as adults vaccinated that we decrease the total transmission in the community, which is what we want out of herd immunity. Now, I don't know that exactly meets the same sort of concept of herd immunity that people have talked about in the media for a long time, that I've talked about as well, as far as being able to decrease the amount of transmission below which the virus will eventually go away. But we do know that getting the kids vaccinated is an important part of what we need to do to be able to decrease the overall risk to the community at large. Just like getting adults vaccinated is an important part of that as well. I will point out one little interesting study that was done several years ago now, when they looked at the average number of encounters per day that an adult has as we go about our average workday. These are significant encounters where somebody spends more than 15 minutes in close interaction with another human being. For adults, it was somewhere either between 6 and 9, I think, encounters per day for the average adult in a typical day. For children, school-age children, it was 50. So when we're looking at something that a disease that potentially can transmit in kids, kids are much better at transmitting because in general, kids are much more sociable, certainly than I am, and more than the average adult is. And so I think that that also highlights the importance, not just of the COVID vaccine, but also of the flu vaccine, as we look at just the number of opportunities that children have to be able to transmit virus within a typical school day. There's lots of opportunity, and where there's opportunity, the virus will make the most of those opportunities.
All righty. Well, thank you very much. I think that has me covered.
Thank you, Aaron. Let's now go to Michael Cavello of the Amarillo Globe News. Michael, how are you?
I'm doing good this morning. Can everybody hear me okay?
Yeah, we got you.
Okay, so I was, I'll ask this one question first. So with the children getting vaccinated, and we know like the effectiveness that the vaccine has on adults, since children have a much younger immune system, will that change any variables? Will it make them less susceptible than adults, or will it basically be the same?
Yeah, so Michael, I think that's a great question. So what we know from the study is that we have about a 90, well, actually it's technically 91% efficacy of the vaccine in those kiddos. And now what we don't know is how effective is that vaccine still 6 months from now, 9 months from now, 12 months from now. The thought would be, and it would be likely, it's plausible that the kids' level of immunity will last longer than what certainly some adults' level of immunity is. So as we look at those folks who qualify for an mRNA booster, we're really looking at those folks who either at high risk of disease, high risk of complications from the disease, or those who are older. So we know that the immune system just is not quite as robust as we get past the age of 60 or 65, just like, hey, the hips are not quite as robust after the age of 65, right? That's just the way that we're designed. And so we would anticipate that the kids will have a robust response that'll be able to last probably a significant length of time. As far as actually being able to put numbers to that, we don't know, right? Because we just don't have enough kiddos that are vaccinated for long enough to know that, all right, well, are they going to need a booster? If they do need a booster, is that in 6 months, 9 months, 12 months, 24 months? We just don't know because we don't have that data yet.
And my next question would be, I was reading a report about people that have, immunocompromised, and it talked a lot about people, especially with iron deficiency, which I guess would attack their ability, to have white blood cells. For those type of individuals, especially with the iron deficiency, is besides just taking iron vitamins, is this something they could do to make the vaccine more effective for them since it has a decent amount of, percentage change?
Michael, I'm going to use an opportunity to broadcast my ignorance. I'm not aware of data on iron deficiency and COVID susceptibility. Now, that's not saying that data is not out there, but of the 30,000 or so papers that have been published, I think, on COVID, that's just a set that I'm not really aware of. I'll have to get back with you on that, and I'll try to educate myself. I would say that I would be cautious about going out and taking large doses of iron, because we know that too much iron can certainly cause its own problems. If someone's iron deficient, they definitely need iron. But if someone is not necessarily iron deficient and they take too much iron, that can actually cause problems to the liver, as well as the bone marrow and several other places. And I would say that if they have questions about that, I would talk to their doctor.
Yeah, I'm gonna relook over that too, because I swore I saw it was from the CDC, but you never know, with that. So I'll readjust that also.
And Michael, there may very well be something out there on that, and certainly I would open up Dr. Gonzalez or Lamentier or Weiss or Casey if you guys have seen anything about that. I just personally, I that's not something I've come across, and I'll have to educate myself.
No, I agree with Dr. Bell. I'm not aware of any evidence to that effect. Doesn't mean it doesn't exist, but I sure would like to see it if it does.
Michael, what I would say is if you look at other states of immunodeficiency, so people who may have had their spleen removed or who have a cancer of the bone marrow, the recommendation is actually to give them as many vaccines as possible. So really, we know that in someone who is immunocompromised, there's a real benefit to any vaccine they can get to try to boost their immune system. So I think COVID is no different.
Then I guess my final question, since we now have the COVID vaccines available for children of a specific age, what can be done to, like, because there's a lot of hesitancy out there, and it's very political hesitancy in some ways, and some is genuine. What can be done to, convince parents of the need and the efficacy of this?
I mean, I think I'll go first and let Dr. Bell chime in. I would say that we need to continue to share the statistics with the public that are factual, that are coming from reputable sources, that are showing what happens for individuals that are not vaccinated. Dr. Walensky, who's the director of the CDC, came out and said this week, they were quoting the number of pediatric deaths that have happened across the country as a result of COVID-19. And that number is far lower than the number of deaths that we've seen in the adult population. Clearly, that is well understood. However, one of the reasons that led the FDA and the CDC to approve the indication for pediatric vaccines with COVID-19 is that we're still having children die from COVID-19. And it made the top 10 list of the reason for death in the age group that now is approved for vaccination. So the point is that it's now one of the leading causes of death over the past year and a half or 2 years, whatever the time frame was they looked at, for children dying. And again, what can we do to prevent that? And the vaccine is the best way to prevent that. So these decisions aren't being made lightly by the scientists and the panels that are looking at these on a national level and are looking at these worldwide. It's just that we have to stop looking at the sources of data and information that are not valid. And I know that's easy to say, but it really is challenging based on all of the information overload that's available for everyone in today's day and age. The CDC, the NIH are reputable resources. And again, the World Health Organization is another one. Look at any of the major medical institutions in this country that are well respected. If someone was diagnosed with cancer, if someone was diagnosed with a rare disease, and they're looking to find, some of the best places in the world to go for their care, we all know Mayo Clinic, Cleveland Clinic, those types of places, MD Anderson Cancer Center. Look at their websites and see what they're recommending you do for vaccination and preventive disease. They're recommending that you get the vaccine. And I'm certain they're recommending that pediatric patients in those age ranges get the vaccine. It's as simple as that.
I think there's something about human nature that we trust who we know, right? So if I had a rich uncle, and unfortunately I don't, but if I had a rich uncle and they died and they left me $1,000 and I was trying to figure out where I was going to invest that, I probably would not just Google it, right? So if I've got something that's of value to me, then I'm going to do something more than just Googling and seeing what pops up. Now I may go, as Dr. Lamentier points out, I may go to a trusted source of economics. There may be some medical journal, economic journal, or I may go to some business school in order to figure out how to invest that. I may turn to somebody that I trust, somebody that I know. Now, it would make sense that I turn to somebody that I trust and know personally, who also is an expert on economics. I probably would not take my $1,000 and ask my plumber, say, hey, where do I need to invest in this? My plumber is an awesome plumber. And he may also be pretty good at economics, but that's not what he does. I think that we need to be able to find folks that we know who are also medical experts, not just self-proclaimed medical experts because they Googled something. So I think that typically then is going to be somebody's own doctor. And I would encourage folks, go to these trusted sites, the the major medical institutions, the CDC, the WHO. Those are all great sites to get information, and then talk with your doctor. I think that if parents have a concern about the vaccine, or if they're uncertain about whether to get the vaccine for their kids, make an appointment, talk with your kiddos. The pediatrician cares about your child, and they're going to be able to give you good advice about your child. And I think that being able to have then that medical expert who you already know and trust, I think that's going to be how we potentially avoid or overcome some of this vaccine hesitancy that we've seen in so many different places. And as parents, we're always concerned about our kids, and that's natural and that's appropriate. We all want the best for our kids. Talk with your pediatrician, see what they have to say about it.
Thank you.
Thank you, Michael. That concludes our news conference for today. I want to thank our panel members who joined us today to provide this information to the Amarillo community. Thank you for your time. Once again, this is David Henry. I'm the Communications Manager for the City of Amarillo.